The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. We're going to get started in a few moments. Welcome and happy Monday, Monday after a break. Hope everybody's doing well. Everybody's on mute to eliminate the background noise, but if you'd like to be unmuted, please let me know and I can unmute you. Just let me know in the chat and we'll get started in a few. Hi, everyone. We're going to get started in a minute or two, just waiting for everybody to get here. Like I said before, I know we've had some of you hop on since then. Um, we're going to be getting started in a minute or two. Everybody is on mute to eliminate the background noise. If you have questions, you can ask them in the chat or as a question. And I will answer those. If you want to be unmuted so you can ask your question out loud, I can do that as well. But we're going to go ahead and get started in a couple of minutes. Excellent. Hi, everybody. Kate, you are an organizer now, so we can hear you.
Thank you. Did you do that just as I coughed?
I did. I didn't. I was like, oh, well, I know it's working.
Good morning, everyone.
Good morning. Um, I know it's right 10 on the dot. Are we waiting for anyone else? Do you want to give it a minute or two?
It looks like we have about 16 attendees on, which is good. And we are going to record it so that way, anybody who is unable to attend today can listen back to this recording, as well as view the webinar part of it to walk them through. Do we have DMH on the phone?
Everybody's muted, so if we do have DMH on the phone, please let us know in the chat.
Okay. So yeah, just to kind of, do you want me to kind of kick it off real quick, Val, or?
Sure, yeah. Oh, DMH is here.
All right, perfect. So welcome everyone. Most, if not everyone, is in listen only. That way we don't have a whole lot of background noise, so that when you guys do listen back to the recording, it can be useful to you. What we're going to do this morning is we have Val Hewitt on the line. She is our corporate trainer, and she's going to walk us through the SOR process, the SOR workflow in the WIT system for Mississippi. If you do have any questions, feel free to type them there in the question area, and I'll be monitoring those and stopping Val and making sure that we address those. And then after the training, we'll also send out the list of questions with answers as well. Make sure you do put any questions there. Even policy-related questions, that's fine as well, even if it's not just WIT's functionality. We do have DMH on the line, so they can help answer those questions as well. And again, because everyone's in listen-only mode, those types of questions, we'll probably send out answers to those after, but we'll make sure we get everything answered. So we're just going to walk through from entering a client all the way through to discharge, and that will include entering the GPRA. So I will, but this is the WIT system was encumbered by DMH, from us at FEI. We are located in Columbia, Maryland. WITS is our system. And many of you, I think, attended the training back in March, but that was before the GPRA was actually placed into your version of the system, before SAMHSA made that decision. So now, now we have the GPRA tool in there that SAMHSA is requiring you guys to use for that grant, for the SOR grant. So Val, I will give it to you and let you take over.
Excellent. Well, I should have put my introduction slide up here. I'm Val Hewitt, and you guys know Kate O'Brien. I am the training specialist for WITS, and I'm super excited on this Monday after a long weekend. I want to say that I appreciate each and every one of you for being here. I know that this is a tough day for reentry. So let's go ahead and get started. One of the things about me as a trainer is I'm pretty laid back. So if you have questions, please ask them. If you need me to go over something again, please let me know. I have no problem going back and reviewing things. The goal here is for you guys to begin to get comfortable using the system and going through for SOAR and putting in the GPRA. So, the more that I can do to answer questions and to make sure that you guys feel comfortable, the better the training is going to go. We're going to go through our agenda. Housekeeping is, just kind of those basic, if you have a question, please ask. It's a fairly short session today, so I don't think we're going to take a break. And if we have any questions that we have to parking lot, like we're talking about before, that we need to come back to, we can come back to those on the question and answer that we'll send out after. Or we've got lots of support from Kate and you guys on the chat. Okay. So what we're going to be doing is we're going to be going through the client search and setup. intake and admission. We're going to talk about outcome measures. We're going to talk about the program enrollment, and then we'll get into the GPRA. We'll review how to put in encounters and how to discharge a client in the system. And so the agenda here is very similar to what we're going to go through with our workflow, because that makes sense to do it in an order. For those of you who don't know, the training site is ms-training.witsweb.org. For this training, we're going to be doing demonstration only. I would say that for those of you who have accounts with the training in the training environment, um, if you have two screens and you're someone who likes to click along, that's fine. If you only have one screen, what I would suggest is that you watch while I go through the process. A lot of times I think when we're going through demonstration, if you're trying to click along, you'll miss things on my screen. And the nice thing is that this is recorded, so you can always go back and play the recording and then pause it, like watch me do the thing and then pause it and then complete the process. So I
Just,
think that, oh yeah.
just to add to that, Val, if you guys haven't received it already, and Val may actually end up saying this, but if you haven't received it already, you'll be receiving a user guide as well to go along with this webinar, and that'll be coming from DMH. So you'll have both this training that Val's conducting today to play along with, like she said, and then you'll have the soft copy Word document, whichever you prefer.
Yeah. That was on my list, but excellent, excellent call out, Kate.
Sorry.
No, that's like, that is 100% perfect. Okay. So, the workflow here is in kind of a way that when we talked about the agenda, and this is a little bit more of an easier to like see spatially, I think. So it's searching and adding. You want to start the episode and record your intake and complete the admission profile. Then we're going to complete the outcome measures and diagnosis screens. We're going to say, okay, this is the program that we're putting our client in. We'll record the program enrollment. And then that's when we have the GPRA process. So we have the GPRA at intake. There's a GPRA at follow-up, which is 5 to 8 months after you've completed your intake. And then when services are complete, we have the GPRA discharge. We also are going to go over the process of discharging a client as well. So that will be excellent. Okay. So let's start, before we hop into the admission profile, let's start with clients. So I am going to bump up my screen resolution just a little bit more to make it easier to see. So on my home page here, what I'm going to do is I'm going to go over to my client list. And before we add a client into the system, I know that you guys know this as a best practice, is you want to make sure that you search to see if your client is there already. You don't want to add in a duplicate to make your administrators' lives more challenging down the road. So if you search before you add a client in, it just helps with that whole process. You can search by these fields by first name, by last name, by social, date of birth, the unique client number. So we have lots of different search options here. If you want to do a wildcard or a partial search, you can use the asterisk. And I can see I search HOL with my asterisk and I get Ray Holt. We can search by first name. Had my caps lock on for a moment. We can search by, first name, last name, all that good stuff. And what we want to do is we want to make sure that we've done that search beforehand. So I searched and found Amy, and I found Ray. Once you find someone, in the system that you are looking for, we can hover over the pencil icon here. We can go to their profile or activity list or their link consents. Activity list is usually where we're going to want to go to see their information. So if they're already there, you don't have to do anything else. You can just, go to their activity list and start working with them. If you do your search, let's say I'm looking for Jake Peralta. If no one has noticed, I have kind of a Brooklyn Nine-Nine theme going on right now. So I get this blue message up at the top that says, no results match your search criteria. So there's no clients that match the first name Jake. I can even, just to double check, I can search Peralta or PER. So we're good to go. I've searched in a couple of different ways, and I haven't found my client. So what I'm going to do is I'm going to click this add client button over here on the lower right hand side, and that's going to bring up the page where I can add in my initial client information. So I'm going to put in Jake here. I'm going to put in his last name, which is Peralta. He is male. Any field that we see here that's this bright yellow is required and has to be added in before you can save the screen. If I were to try to save right now, it would give me this red message and highlight the fields that we're missing that are required in red to call them out for me. And then I'll put in, I'm just going to make up a fake social security number. And I'll put in a provider client ID. And once I have that completed here, I'm going to go ahead and click Save. And that saves my client here. I can, at this point, I can click Finish, or I can cycle through. There are additional fields for alternate names and additional information and contact information here. So we can go through and fill out this information as well.
Val, just one thing, if I can say, just one thing.
Of course.
So now that Val has saved that, I just want you guys to see that up in that left-hand corner, you saw how the UCN, that unique client number, was created for Jake. Before, there was no UCN in that upper left-hand corner. If you need it for whatever reason, get out of this client, you just hit that X button, and that would clear you out of this record. But at this point, if you have something up in that left-hand corner, if you have a name and a UCN, whatever you do from this point is going to be attached to this record, so just be cognizant of that.
Yeah. So it's kind of like the tabs on a file folder. So right now we're in Jake's file folder. So everything listed under here is going to be for Jake. And then if we go back out, if I just save this and click Finish here. If I close out this tab here, I'm not on Jake anymore. So if I go to the client profile here, it's going to say no client selected. Please select a client first. So from my search here, I still have the search listed for PER asterisk, and that brings up Jake here. And when I click on, if I hover over the pencil and I go to his activity list here, then that'll open up his file folder, his file again, and then all of the items on this left side, like for the client profile and for our activity list, will all be for Jake. Excellent. So once we have Jake in the system, what we're going to do next is we're going to go to the activity list here on the lower left-hand side. And when I go to the activity list, you can see here that this list is not very long because we haven't started a new episode. So what we want to do is we want to start a new episode of care for Jake. So I'm going to click that link on the right side. And from here, you can see we've got a bunch of required fields.
Hey Val, did
Yeah.
we finish all the client profile pieces?
I'll go through all of them?
Well, just, there were a few screens that are important there. We want to make sure we have the collateral contacts.
Mm-hmm. Okay, no problem.
It was like,
So I'm going to go back to his client profile here. And then, so we have his original information, and then I'm going to click the next arrow here. If he has any alternate names, we can go through and add those if he's got an alias or something else that he goes by. If he doesn't, we can just hit that next button over here. And then the additional information I went through, I filled out his ethnicity and his race. If he has any special needs, we could use the mover boxes to move those over. If we want to fill out some general client comments or veteran status, the fields that are the lighter yellow are state required, as opposed to the darker yellow, which are system required. Then,
yes. And just to mention too, so the light yellow are also TEDS reporting required. So, and Mississippi is requiring all programs, even SOR, be reported as part of their TEDS data. So that's why you guys also need to fill in the light yellow fields, and that's why we'll be doing outcome measures as well and filling in all those light yellow fields.
excellent. All right. And then I'm going to hit the next button once I have that filled out. And here's where we can put in the contact information for the client. So I'm going to make up a phone number here. And I'm pretty sure that that is too many digits. So okay. And then I'll put in a mobile number. I actually don't know anybody who has a home number anymore. I think my parents still do. And then I'll go ahead and add in an address. So client home.
And you only need at least one phone number and address, and this is super important for the SOAR grant, as well as the next screen that Val will show you, which is the collateral contacts right below contact information, because when you guys go to start the follow-up process at 5 months after the GPRA intake interview date, you'll need ways to get a hold of this person. So the more ways you have to get a hold of them, the more opportunity and the more likelihood that you will get a hold of them for the follow-up.
Yes, and one of the things that I like to say when it comes to this kind of data entry is that you want to try to make your future life easier. I have a post-it usually on my computer that says, "What are you doing to make future Val's life easier?" And if you have the information sitting in front of you and you can just put it in, like you might as well do that now rather than, a month from now when you have to like search through all the paper on your desk or, go through like a hard file. If you've got it, if you got the person or if you got the file in front of you and you can just put it in, it'll just make your life and, the lives of your coworkers who also need to access this information easier. All right, so I put in some contact information here, and then the next screen is going to be collateral contacts. So these are, so I'm going to click that add contact button here. So these are people who are, close with your client. So let's add in Charles Boyle. And he is, I guess we don't have friend in here, so let's say that he is the brother.
Any value that you guys don't see in these drop downs as Val is walking through this, again, this is training, so not everything might not be in here that's going to be in production, but if all these drop downs can be managed by DMH, So anything that you guys need to, perform your jobs and your workflow and your process at your agencies, just let DMH know, and they can add whatever values you guys need.
Excellent. Awesome. All right. So I'm going to go ahead and fill out that information. Put in a mobile phone for him. And once we have that information filled out, this can contact means that we can contact that person. It's usually pretty helpful if you're adding them as a collateral contact that they can, that you can contact them. So I just wanted to point that one out. And we have a space here where we can put notes as well. And it's going to be active as of today's date. So once I have that done, I'm going to go ahead and click finish. Oh, my phone number is invalid. Probably too many digits. There we go. So that has added Charles as a collateral contact for Jake. I'm going to click that next arrow. There's a screen for other additional numbers if we need to add those. And then we have, there are screens for client history, client group enrollment, authorization, employment, and allergies. Did you want me to review any of those, Kate?
So if we can just click on history just to show them, and then
Okay.
client enrollment is very important if they want to bill for the services.
Yes. So the client history, which is really cool, is you can see when changes have been made to the client. So all these changes that I just made, I'm logged in as Val Hewitt, will show that what system account made the change and what the description of the change is. And then
that's really helpful too from an auditing perspective, because it also shows you guys who accessed it, even if there were no changes made. And so that's part of our HIPAA compliance 42 CFR Part 2, so that you guys can see that, keep track of that. You can see that only those in your agency have access to that record, and that's just a good auditing area for you guys.
Yeah. Excellent. And then the client group enrollment here. You can go in and add a benefit plan enrollment or a government contract enrollment. I'm going to go ahead and add in a benefit plan enrollment here.
I think they might be, and correct me if I'm wrong, Denise, I think they're going to be under government contract.
So I will add a government contract.
Like Medicaid or something like that, but for SOR, I believe it's government contract, and we'll just confirm that. But basically what this does is this is putting Jake, this client Jake, into a group that's specific for the services he'll receive, so that you guys can bill and receive payment on those services. So when you get down to encounters, if they're not enrolled in a group, you won't be able to do your encounter. So this one's really important to do at this point in time.
Excellent. So I'm going to go ahead and choose SOR General here and put in the start date. I'm actually going to backdate this to the beginning of November. And then once I have that done, I'm going to go ahead and click Save. And that has added my client group enrollment here as well. So I have my start date. I don't have an end date yet because it has not ended. Okay. Does anyone have any questions about that process? Or does anybody have any, want me to review something again or show a screen again?
I'm monitoring. I'm not seeing any questions at this time or anything in the chat window.
Excellent. Okay. So then let's hop over to our activity list over here and create our new episode. So to create an episode of CARE, what we're going to do is click on this Start New Episode link in the upper right-hand corner. And then from here, you can see we've got a bunch of required fields here. What type was the initial contact? And then what is where's the residence? I'm just gonna pick what the source of the referral is, and we can see this list here. So I'm going to go ahead and say, let's say his employer EAP referred him. If he was referred by his one of the collateral contacts, we could choose that option here. Then the case is open and active. The initial contact date, I'm going to backdate over to the 1st. And then with the intake date, I'm also going to backdate that to the 1st of November, just to give myself a little bit of space to play with.
And just to note there, guys, the residence field, that 1, 2, 3, 4, that 4th field down, that's the residence of the client. If you hover over it, it lets you know that. It's not the residence of where the intake is taking place, okay? That can help put them in programs that are close to them in terms of their residence, their county. And then the initial contact date and intake date, the difference between those two, the intake date is going to be the actual date that the intake occurs. The initial contact date is they may have called, 2 weeks prior and scheduled to come in. That would be the initial contact date. So that's just the difference between the two.
Excellent. And then we'll mark if they're HIV positive or if they're an injection drug user, and choose the problem area. So I'm going to say drugs for this one, and say Jake is having some trouble with OxyContin. He is dependent on use and it is affecting his life. Down here below, we have if the person is involved in a special initiative, first time DUI, second or more DUI, if it's part of an interagency service. We can, and if we want to choose those, we can just highlight them and use the mover boxes over to indicate that initiative is selected.
Now we know you guys also have your own systems already, and that this is for SOR. So really focus on, Val's walking you through and explaining what the optional fields are as well, but your focus really is anything yellow. So the light yellow and the dark yellow is really what you need to fill in at a minimum. So, but if you want to fill in more, because whatever you put in, you can report out. It's totally up to you. But we want to make this as quick and seamless as possible.
Yes, definitely. So I'm going to go ahead and click Save here. And then once I've entered the information in, I'm also going to click Finish. And that will, now on my activity list, I can see that my client information profile has been completed. The status is completed here. And my intake transaction, which is what happens when we create that client information and fill out that episode of care, is completed as well. So,
and go ahead. Were you going to talk about the pending?
I was, but that's okay. Go ahead.
Oh, no, I was going to say, yeah, so if Val had gone back and done those client profile pieces, those extra screens, the status that she has highlighted would say pending. And you could click on that and you could, it'll show you exactly what needs to be filled in. Typically, it's going to be any yellow or light yellow, dark yellow fields on screens that haven't been filled in.
It's pretty handy, and the way, like, one of the things that as I was going through and as I was learning the system, having the pending for an in progress item completed, sometimes you can't move forward with a different step until you've completed a previous step, and so it's super helpful to be able to go back and say, oh hey, that's what I forgot, and then be able to go back, fix it, and then go through. And I'm going to, when I demonstrate a little bit later, I'm going to demonstrate, I think, a place where people do tend to struggle a little bit, just because and by people I mean I tended to struggle when I was learning. So I think it's a good call out. So we've searched for our client. We started our new episode and recorded our intake information. The next thing that we're going to do is we're going to complete our admission profile. So our admission profile has some very basic information on it that we're going to fill out. And I know you guys, it's going to be so long to do. Let's see, let's bring that up. So what I'm going to do is for Jake, under my activity list, I'm going to go down to our admission section. So from the admission section here, I'm going to click on that link and see how very long and challenging this is. I'm going to backdate this to the beginning of November. So my admission date is the 1st of November, and we have our admission type, the staff member, which defaults to my name, and then this up top here is information that was pulled over when we filled out the client profile information. So once we have that complete, once we have that set, we're going to go ahead and save. From here, what I'm going to do is click the next arrow just to kind of show you guys what else is here. If it's a youth admission and you want to fill out that youth information, it has the youth information to fill out here. And then if I click that next arrow here, it has assessment scores. If you're tracking assessment scores for medical or employment or drug or legal or family, those are all here. Once, if you want to if you are filling those out, you can fill those out, click save, and then once we're done filling all those screens out, we're going to click finish. And that'll direct us back to admissions. So now we have that in progress here. And if I click that, it says, hey, a client program enrollment is missing. So I haven't filled out my client program enrollment yet, but that's not something that I need to do quite yet because there's a step in between. Does anybody have any questions about completing the admission screen, admission profile? Okay.
Yeah, I'm not seeing anything.
Excellent. So either everybody's grabbing it or everybody's still waking up with their coffee this morning. Could go either way. The outcome measures that we're going to be filling out next. The first screen is the client status. And so this tracks information that goes to Eagle Tech, that goes to SAMHSA. So this information, there's some required information on these screens that we need to fill out. And it's pretty critical to fill these out because this will affect the information that we're going to be filling out later. So there's a workflow as you go through the WITS system, so that everything kind of happens in an order. And the kind of big first part of this is that we have our outcome measures filled out. So I will go back to my WITS screen here. And from here, I'm going to go down to outcome measures in the lower left-hand side. And then from here, I don't have any outcome measures, so I'm going to click that Add New button on the upper right-hand side. And we can see that this date on here pulls, our assessment date pulls from the date that I entered that the client was admitted or entered in. And we have our domain. So I'm going to use the mover boxes from the left side to the right side. And then from here, what we're going to do is we're going to fill out the information. You can see that there are a bunch of bright yellow screens and a bunch of the lighter yellow screens, but we're going to fill fields, but we're going to fill all of those out. So I'm going to say, no, it's not codependent. And then I'm going to choose no for co-occurring substance abuse and mental health program. He's not doing medication assisted treatment. And let's say he's had one prior substance abuse treatment episode. And then this next question in the profile is the number of times the client has attended a self-help program in the last 30 days. So let's say he hasn't had any attendance in the past month. From here, what I'm going to do is I'm going to fill out his education status. So let's say he's had 3 years of college and he's employed full time, and he has Blue Cross Blue Shield. He is married. He is not indigent. His source of income is his wages and salary. He has Blue Cross Blue Shield, and his living situation is, let's say, independent living. How many arrests he's had in the past 30 days, I'm going to mark that one as 0. But you'd want to do what, makes sense to your client. And then we have the mental health legal status that we can choose. And then here we have our substance abuse. So the primary, I'm going to choose other opiates and synthetics. And then from here, I'm going to choose the severity and the frequency and the method and the detailed drug code. So let's say it's oxycodone. And then we have at what age did the client first use substances indicated above. Let's say he was 16. And then from here, I'm going to save this and then go to the next screen. And if you've recorded the ASAM here, this is where you can put in the information from the ASAM. And then the next screen is going to be the client diagnosis screen. So what we're going to do is we're going to go ahead and put in the diagnosis. So in the upper right-hand corner here, I'm going to click Edit Diagnosis. And,
Hey,
oh, yeah.
I just want to mention there, if for whatever reason you guys don't have that edit button when you go to do the diagnosis, it's just because you need that role. I know DMH is working on getting everybody's accounts and all set up with the right roles. So if you don't have that, just email DMH and they'll just add that role to your account.
Gotcha. So I'm going to choose behavioral, and then for the drop downs to show up, you would need to put in 2 or more characters. So I'm going to put in OP for opioid use. And choose an option here. And this is going to be his principal diagnosis. Once I have that completed, I'm going to go ahead and click Save. We can also add some comments in there if we want. And, for the diagnosis, if the person has more than one diagnosis, you can put in the diagnoses that they have. Once you have that complete, you can go ahead and click that save button. Oh, here, the finish button down at the bottom. So now on our client diagnosis screen, it has that behavioral diagnosis here. And if you ever need to go back in to add in an additional diagnosis, you can always go back and add in the diagnosis for the client. Once we have that information done, I'm going to go ahead and click Finish. Does anybody have any questions about the outcome measures or anything that I've just gone over?
I am not seeing any questions or chat. Just Just to note, though, I believe you need a diagnosis, a primary diagnosis, to finalize your outcome measure, right,
So
Val?
I have that done, but I didn't do something on purpose to get it to trigger this not being completed.
Perfect.
Because this was a very hard thing for me to learn. And so I want to make sure that I point it out to these guys. So this says in progress now. The next thing that we want to do is our client program enrollment. And one of the things that are pretty critical about the client program enrollment is that you have to have the outcome measures completed. So if I go to my left-hand side here, I go to program enrollment, and I'm super excited. I'm doing my thing. I click that add enrollment button on the right side here. And I'm like, excellent. It has my start date from when I put that in before. I'm going to choose my program name. My person didn't spend any days on the wait list. And so I'm going to click save. And I have a problem. So it says there are no outcome measures within the past 14 days. And that can't be right because I put it in. What happened is there's an outcome measure, but if it's not completed, it won't register for the program enrollment that it's been completed. So for my outcome measures, if I go to my activity list here, and I go to outcome measures client status, and I click on that details button here, I get a little pop-up message that the secondary substance is missing. So what that means is if I go to my outcome measures here, it lets me know that if I hover over the pencil and I go to review, it's sneaky and it's gotten me a bunch of times. What I want you guys to do is to make sure that you put that secondary in. Even if there is no secondary substance abuse, you need to go in and choose none. So if Jake's deal is just that he's got an issue with opiates and he doesn't have an issue with anything else, then you would just need to go in here and click none and then save and finish. And
Yeah, and the
now,
reason why is because
okay, go ahead.
typically you have an initial, you're fine. They probably want to know why. If you have a primary issue, there's typically a secondary. But like Val said, if there isn't, just click none.
Yeah. And that was that was the one that I think was the biggest block for me because I was like, why? I did it. Why is it not? And I just missed that light yellow required screen. So now
Yeah.
it says completed here and I'm good to go. So all the people are happy in the land. So from our program enrollment screen on the left side over here, I'm going to go into to add an enrollment. Click that button. And then I'm going to choose my program name. No days on the wait list.
Val, is that one that has the grant?
It does.
Okay.
Yeah.
So that one, do you know, also, I'm just curious, does that have MAT chosen as a specifier, just so it shows up on the encounter?
I don't know off the top of my head.
That's okay. I can talk about it when we get there.
Okay.
We'll see.
So I'm going to choose I'm not putting in an end date because obviously you're just starting the program or a termination reason. So I'm going to go ahead and click save and finish here. And that creates my program enrollment. So once I have my program enrollment, you can see here that we have additional options on our left side menu. We've got the GPRA that we can fill out as well, which we'll be doing next. Does anybody have any questions?
It's saying you need to choose a SOR program for right. Yes, Denise. Yeah, you need to choose a SOR program that has the modifier on it. But support is not done updating those. So Val went ahead and chose a program that we know does have the SOR in that grant area. So the GPRA pops up. So just so you guys are clear, I was answering a question from DMH. If you guys are going through this workflow and you get done enrolling your client into a program and you don't see the GPRA, if you can just pop over, yeah. So if you don't see the GPRA there, what that means is that you did not enroll that SOR client into a SOR program. And you guys can't see that profile of the program because DMH sets them up, but they will let you know what programs are there that have the SOR grant in them. So as of this morning, we were testing. Not all of them have been updated with the SOR grant, so that's why Val chose this one so that you can see the GPRA. But DMH will send out a list of programs for you guys so that you know which ones you guys should be enrolling your SOR clients in. So if you don't see the GPRA there, it means you haven't enrolled them in a SOR program, and it also means that you need that GPRA role, which DMH can add to your account. So just make sure you email DMH if you have any issues there.
Yeah. And so Denise said they've all been updated. Have they all been updated in production, Kate?
We'll have to check with support.
Okay.
Because I know this morning when we were testing here, they weren't all updated in training. So we'll just double check.
Yeah, so it may be different, Denise, for training as opposed to production, but in training, they're not all updated. All right. So in terms of the GPRA process, we have 3 kind of times that we record the GPRA. There's a GPRA at intake, there's a GPRA follow-up, and there's a GPRA at discharge. And so when we're filling this information out, we want to make sure that, like with everything, we're filling out the GPRA as completely as possible. And then, as Kate was saying, if you think you should be able to record the GPRA but you're not seeing it, you want to go ahead and contact your admins to make sure they give you you have the right roles and all that good stuff. So once we record our intake, the follow-up is recorded between 5 and 8 months after the intake is recorded, and that's part of the grant requirements. So we want to make sure that you're recording those follow-ups in that 5 to 8 month window as well. Denise said, if you want to look at a client in the main facility, I created Christmas tree this morning and selected a SOR program. Yes, I can go and point that out.
Okay. And just so everybody else is clear on the phone call, on the webinar, you guys can only, you guys will only see the agencies that you guys have access to. Val has WITS administrator rights, so she's going to pop over here to show you that. But it looks like, Val, whatever program you were going to use was set up with the SOR grant as well.
Yes, yeah. I wanted to go over to Alphabet is hard, main. What do you know what agency the main? Oh, agency is Region 1. Excellent. Oh, so Region 1, Maine. Excellent. So, and Denise with the seasonally appropriate. All right, so we have Christmas tree here, and then I'm going to click on the pencil and go to Christmas's activity list. And from here, if I go to the client program enrollment here, it's the SOR MAT program.
So, yeah, so now, so is this one, if you go to encounter, because that's what I was talking about, Denise. We want one that has the MAT on it. Let's see if it's on encounter. So we can show the MAT is on there. So it looks like this one has the services. So you click on edit. So you see there, guys, down like middle to lower screen, you have your evidence-based practices as well as your medication-assisted treatments down there. If you're not in a SOR program that has medication-assisted treatment as the modality specifier, then this won't pop up on your encounter, and the state does want you guys to record these. So again, this is just another thing to look for, that if you don't have access to record these on the encounter, then you probably don't have them in the appropriate program, or contact DMH, and they may just need to update that program profile. But again, they'll send out notification on what programs are supposed to be slated for, SOR clients, that sort of thing. Currently, in the evidence-based practices mover box right there, if you can just kind of hover over that, Val, and circle around that, DMH is working on updating them and defining them. So if you don't have one there that fits, then you can choose other for now. But they will be sending out notification as well once they're defined.
Excellent. Yeah.
Perfect.
All right. So I'm going to go back over and, oh, hey, I'm going to click cancel here, and go back over. And this is like a good, review of how to find a client that you're working with. So I was at Fairland. Go back to my client list. Type in Jake. All right, so we're going to go back to Jake's activity list here, and we're going to fill out his GPRA at intake. What's important to know about the GPRA at intake is, and all of the GPRAs, is that you want to do them in one sitting, because as we go through, we want to fill all of the information out, because if we try to go back, it doesn't save the changes, Kate? You just have to do it all as one, right?
Yeah, so currently, SAMHSA's requirements for this is that you ask these questions in one sitting, because they want to know how the client is doing at that specific time when they're interviewed. And then they want to see a follow-up if anything has changed. So currently there is no save button on each of these screens. So if you do enter, and you'll see as Val moves forward, she'll enter in some information on a screen and she'll go back. You'll also get a question that prompts you saying, are you sure you want to move back, because your changes won't be saved, what you entered won't be saved, and it won't save that screen. So just make sure. And then once you get all the way through, there isn't a save button at the end either. I think it says finish or finalize. If you don't click that, then it will not save your GPRA. So make sure you, at the very end on the summary, which Val will show you, make sure you hit finish so it completes it.
Yes. To go through all of that work to then not save it would be a real sad time.
And this is your GPRA intake interview. So as Val mentioned, you have your GPRA intake interview, which you're going to enter when the client is there in the setting. And then from there, and we'll do another training in terms of follow-up, and DMH will send out communication on the follow-up process and who's responsible for that and whatnot. But 5 months from that date that Val is entering in that field right there, the interview date, so SAMHSA, their required date is going to be 6 months from that date. But you can start trying to get a hold of that client. That window opens at 5 months from that date, okay?
Excellent. Yeah. All right. So once I have that date here, you can see all these fields are grayed out. But once I hit that next button, it'll fill out that information for us once we go to the final screen.
And if you have been entering some on paper, because I think it was June 24th, SAMHSA is when they announced and they wanted that the GPRA tool is going to be used, and that grantees were supposed to be entering in data. If you do have GPRAs that were being done on paper, they can be back data entered into the system with all of their true dates and information. So that's just something to keep aware of. And then as you move through the GPRA, there will be a value that says missing data. That value, you try not to use that too much unless you're truly missing that data. Like, let's say you did have it entered on paper, and there wasn't an answer put in that question area. That would be your missing data. But they do have the values of don't know, that and that sort of thing. So try not to do a whole lot of missing data. There is refuse, there's don't know, and Val will show you all of that. But just to note that.
Awesome. So from here, we're going to choose the diagnosis from the drop-down list. And we can choose the category here for 3 diagnoses. We also have the don't know or none of the above here, but we definitely want to, if we have that information, put it in.
You guys can just pull that too from your diagnosis screen that you entered earlier in the process.
Mm-hmm.
It could be the same thing. So if you pull that.
Yeah. In the past 30 days, was the client diagnosed with an opioid use disorder? If you choose yes, then it will bring these up to answer for the medication that they received. In the past 30 days, was the client diagnosed with an alcohol use disorder? Again, the form is a SMART form, so if you choose no, it doesn't give you these options, but if you choose yes, it does give you the options to put in the medication. And then, was the client screened by your program for co-occurring mental health and substance abuse? Did the client screen positive for co-occurring mental health and substance use disorders? So we're filling out that information. Once we've filled out that, we're going to hit the next button here. And then from here, we have a bunch of things that have defaulted to no, which you want to be careful when you're filling this out, because it's, I think, easy sometimes to be like, oh yeah, these are already filled out. You want to go in and record the planned services. So I'm going to say, okay, yes, case management and intensive outpatient and recovery support. So you would choose the planned services during the client's course of treatment here. If there's an other, it will open up this other box to put in that option. So you just want to go through and put in what the planned services are. Once you have that complete, I'm going to hit the next button. And from here, we're going to pull the treatment services. So screening, if there's going to be treatment, or let's do treatment recovery planning.
Typically, you have, typically for the grant, so you have your top 3. So you have your brief intervention, and then you have your brief treatment, and then referral treatment. So whatever one makes sense there, it'll be typically 1 out of the 3, and then whatever other treatment services they receive, you can include them as well.
Okay. So we'll go ahead and fill out that information. Then once we have that filled out, we're going to hit the next button here. And then there's the case management services. If they're going to be getting family services or childcare or employment service or medical services or aftercare, let's say aftercare and relapse prevention, and some self-help and support groups and some individual services coordination. So we'd go ahead and mark yes to those that would apply for our client. And then once we're done, just like before, we're going to hit that next button to move on to the next screen. And from here, we're going to choose education services if they're receiving any education or peer-to-peer recovery support services. Let's say,
yeah, go ahead and take one of those. And because this is a short screen, so I don't, make you do too much work. Go ahead and click that back button just to show. So Val went ahead and chose yes for number 3, and now she hits that back button. This is going to show that
all
question.
entries on the last screen will be cleared. Would you like to continue? So this takes me back to my previous screen. So let's say, oh, well, they need some employment coaching. I forgot that that's one of the things. I can go in and change that and then move to the next screen again. But all the changes that I made before aren't retained. So we'll move that one to a yes. Yeah. So once I have that filled out, I'm going to move to the next screen here. And you guys, one of the things that as we go through the GPRA, it'll put in we'll kind of see from on the left-hand side as we're going through the screens that are applying. So then we'll put in his gender. He is not Hispanic or Latino. And he is white. So from here, we have the information was pulled, his date of birth was pulled from his client record here. And we can fill out this demographic information. Once we have that filled out, we're going to move to the next screen. And then it asks some military questions. So if he has served in the military, then it'll keep these questions required. If you choose no, it grays them out so that the system knows that you chose no, so it doesn't ask you these additional questions. And that's for data quality, to make sure that people aren't answering the other way, or saying no and then saying, oh yeah, they deployed to Korea or they deployed to Iraq in the system. So let's go ahead once we have that done and move to the next screen. Is anyone in your family close active duty or in the reserves? Yes, only one. Let's choose his sister. And answer these questions. Were they physically injured? Did they develop PTSD? Did they die or were killed? And then we can go ahead and add or remove the family members here. And then once we have that filled out, I'm going to go ahead and click that next button to go to the next screen. And then in the past 30 days, how many days have you used the following? Let's say he drank 6 times in the last 30 days, and 4 of those times were to intoxication. And 0 times it was 4 or fewer drinks. He didn't do any illegal drugs. And so once we have that information filled out, we're going to go ahead and move to the next screen. And then here, because we have those 0 here, because he hasn't done any illegal drugs, if you put in, let's say, put in 2, we have the options for refused or don't know, and then the route. But I'm going to leave these as 0 because I didn't choose any illegal drugs. And then I'll go ahead and click the next screen. Oh, you know what? I want to go back. Oh. Oh no! I meant to hit the back button. Sorry, guys. I'm just gonna go through this real quick. Oh no!
So you guys see how it is a little bit easier to do that. So Val's just going to walk back through this quickly. Val, if you just want to enter like as many no's as you can.
Yep.
But while she's doing it, if anybody has any questions, if you want to type them in the chat window or the question area, I can go ahead and answer some of those now. As I mentioned before, you guys will be receiving, if you haven't already received, documentation, user guides that will also help you walk through this, as well as this demo guide, and as well as communication from DMH regarding some questions that came up today, just in terms of the programs and just things that you guys need to know. to get you through this. But, any policy or process questions that you do have, just make sure you reach out to DMH, or if you don't ask them today. I do have a question. Can diagnosis be auto-populated from diagnosis entered for the client? So currently, it cannot be auto-populated into the GPRA without approval from SAMHSA. So Denise, if you want to, anything you want brought in to the GPRA, if you want to email your GPO and ask them about that, we would just need approval there.
Okay.
Any other questions? Just going to consider.
Here's a process question that I actually have, Kate.
Sure.
If someone has an OxyContin like a substance abuse issue, would that count as an illegal drug? Because theoretically they could have been prescribed it legally.
Right, it depends.
Okay.
Yeah, it depends on it depends on how they're using it.
Okay. Solid.
Illegal is typically going to be like your heroin, your, but can also depend on how they're using it and how they were prescribed it. If it's prescription, then it's illegal use of it. And again, that would also be a question to state policy, how they want the GPRA entered here for DMH to answer that.
So let's say 10 here.
A lot of times they'll start using pills, opioids, and then get a cheaper form of heroin.
In an escalating. Excellent.
Yeah.
Okay. Okay. So now I'm back where I was on the right screen. So I'm putting in 10 days for OxyContin, oxycodone. And then the route here now is required, and we'll go ahead and choose oral. So Denise asked, can you ask providers if they have this information and doing it manually? So providers.
Yeah. That's what Val and I were mentioning earlier. Have you guys been doing this on paper? Is that what you mean, Denise? If they've been doing it on paper? Yeah. So if any providers have been collecting their GPRAs on paper, there was I believe it was June 24th or July 24th. I believe June 24th would have been when you should have started. So I have a question for DMH. For all of the information that is required to be captured in WITS, will this required data be included in future record guide changes? Denise says yes. Sarah. Yeah, so if any providers, if you guys have been entering these on paper, if you could just comment in the question area or the chat window so we can see that. That way, yes, Denise said the record guide will be replaced with the WITS guide, and that will be sent out to you guys. I'm not seeing any responses, but if you guys have been collecting them on paper, as we mentioned earlier, you can backdate in WITS, and they can be entered into here if they have not already been uploaded to SPARS. So, the data collection site for SAMHSA, because we don't want the duplicate collection. Yes, Denise, all this is updated in the guide that I sent you guys that was updated. Okay, I'm not seeing any comments or questions from any providers, so if you guys have been collecting them on paper, please reach out to DMH and let them know that, because if they haven't been entered into SPARS directly yet, then we could potentially get them into it, and they can count towards the numbers. So you can reach out to them, let them know that, okay?
Excellent. All right, so I answered my, oh goodness. So in the past 30 days, have you injected drugs? I chose no for that option. I'm going to go to the next screen. And then now we have some family and living conditions. So where they've been living in the last 30 days, if they were housed, where they were housed, either at a residential treatment or their own apartment or someone else's apartment. Um, how satisfied are they with their living space? How stressful have things been for you for the last 30 days? Um, has alcohol or drugs caused you to reduce or give up important activities? So I'm choosing somewhat for that one, or cause you to have emotional problems. Um, because I chose male as the gender on a previous screen, that are you currently pregnant is not applicable here. And let's say he does not have any children. If he does have children, it'll have those additional child questions. And then once I filled that out, just like before, I'm going to hit that next button. And if they're currently enrolled in a job training program, the highest level of education they've received. So I'm going to say that he's got his third year completed. Is he currently employed? And then we'll put in his wages. And then from here, if he receives public assistance, we would put that here. Retirement, disability. If he has non-legal income, let's say he gets $100 from family and friends, and then no other. And then does he have enough money to meet his needs? Let's say mostly. And then once I have that completed, I'll go ahead and click the next button. And then in the past 30 days, how many times has he been arrested? How many nights has he spent in jail or prison? Or how many times has he committed a crime? And this is going to tie in, if I put in 0 here, and then he's not awaiting trial or on parole. If I go to the second, go to the next screen, it's going to give us a message. You reported that you've used illegal drugs in the past 30 days. Then how many times have you committed a crime should be no less than what was answered on B1C, that first screen, that earlier screen, because taking illegal drugs is a crime. So I'm going to put in the number that I had for the number of times he did illegal drugs, and then move on to the next screen. Then it'll ask us some questions about his overall health. So let's say he's got pretty good health. In the past 30 days, did you receive inpatient treatment for physical complaint or mental or emotional difficulties or alcohol or substance abuse or any outpatient treatment for these? So I'm just going to go ahead and mark these as no. If you do mark them as yes, how many times? And then we do have a column for refuse, don't know, missing data. So he hasn't been to the emergency room. Then once I'm complete, I can go ahead and click that next button. During the past 30 days, did you engage in sexual activity? Then we put in the number of contacts and the unprotected sexual contacts. And then from here, it asks if they've been tested for HIV, and if they've been tested, if they know the results. It doesn't ask what the results are, just if they know the results. Then we'll put in the quality of life, how satisfied they are with their health, if they have enough energy for everyday life, how satisfied they are completing their daily activities, and how satisfied they are with themselves. So we will go through these mental and physical health questions. And then once we have those complete, we're going to click that next button. And then from here, we have the number of days that they experienced a serious depression, if they've experienced anxiety or tension, hallucinations, understanding, concentrating, or remembering, trouble controlling violent behavior, attempted, oh, that's an O, not a 0, attempted suicide, been prescribed medication for a psychological or emotional problem, and then how much have you been bothered by these psychological emotional problems in the past 30 days. So once we have that filled out, we're going to go ahead and hit the next button here. And then for violence and trauma, have you experienced violence or trauma in any setting? And then in the past 30 days, how often have you been hit, kicked, slapped, or otherwise physically hurt? Then,
just to note, Val's walking through this like step by step and really, touching on everything, and then she had to go back. I don't know how long it's been taking you guys on paper, but we got some responses back, just letting us know that it's taking about 15 to 20 minutes to get this done, if not quicker, from other providers in other states that have been using this for a while now in WITS. They did say that it made the process quicker than doing it on paper. So just so you guys are aware of that.
yeah. And Kate, we got a question in the chat about the client profile and the GPRA. Can you just enter the client profile and do the GPRA?
Yeah, I just saw that. So Denise, that is really, so that's your call. So the way the program needs to be entered because of the way the SOR workflow is set up in WITS. So at a minimum, you need to enter the client profile, enter them into a program, and then you can do the GPRA. But because you guys are reporting all programs to TEDS, including SOR, which you don't have to, SOR isn't required by SAMHSA to report there, but it's requiring the rest of the other steps above. But the typical SOR process is typically pretty short. It's pretty quick. It's the client profile, do the quick intake, program enrollment, and then do the GPRA. So that's really a call that you guys will need to make. Just let us know, and we can help you switch those programs over to non-TEDS reporting. But that just depends on your process.
Gotcha. Excellent. So I'm going to hit that next button here, and we have the social connectedness questions. So I'm going to just go ahead and fill these out. And click that next button. And this brings us to our summary page. And this is the one that Kate was talking about before. You want to make sure that you scroll all the way down to the bottom, here, and click that finish button, because you don't want to have gotten through recording all of that info and not have that completed. So I'm going to go ahead and click that finish button. And from here, now it brings us back to that GPRA intake, the GPRA page. And from here, we have the GPRA intake. That's if you wanted to add another GPRA. I don't know why you would, but this is where we go to add in the follow-up and add in the GPRA discharge. If we need to edit or view, so if I click that view button, that brings us back to a view only. And you can also click this generate report button up here. And what that generate report button will do is give you a printer friendly version of the GPRA, so you don't have to print the sides or the top of what's in WITS. So if you need to put it into a paper file, this is the easiest, I think, way to do it.
Yeah, and each client you only need one GPRA for each client. So once you have that GPRA intake interview and that GPRA list that Val was showing you, So once you've gone through, you've created the GPRA intake, up at the top, when it's time to do the follow-up, you would just come right back here and you would click on Add GPRA Follow-up, and then when it's time to do the discharge, you would click here and add and click on Add GPRA Discharge. The most important pieces are the intake and the follow-up. The discharge is not as important to the grant as the intake and the follow-up, and then it would be good to do it that way it's completed, but the intake and the follow-up are the two really important parts of the grant.
Excellent. And did we want to show the follow-up list, screen?
Not here, not yet, because I don't.
Not this one. Okay.
I need to talk to DMH and see who's going to be doing that, and so if you go back to client list, or if you go back to activity list, so we filled out the GPRA intake, right? And so, while they're in treatment, even before the follow-up, they're going to start receiving services, right? Treatment. So they could have one-to-many encounters. So do you want to walk through encounters?
Yes, I do. So I'm going to fill out an encounter. So to fill out that encounter form, what we're going to do is we're going to, on our left side panel over here, I'm going to go to encounters, and just like before, there's an add encounter link here. So I'm going to click that add encounter link, and then we have what type of note that we're filling out. So if I'm filling out a progress note here, and then I'm going to put in my service, so I'll choose what services would apply and what the start date is. So I'll put in that 1st of November. And then the duration, let's say it's 50 minutes. And the number of service units, let's say it's 10. And then we'll go ahead and save this here. And then I'm going to go to the next screen. And from here, we can add goals and objectives and interventions, but I'm going to put in my note for the encounter. So this is my note for the encounter.
And this part's very important while she's typing that. If your encounter is not signed, so if you don't add the note and sign it, then it won't be able to be released for billing. So if this is a billable encounter for those services, you want to make sure that you do enter in a note and sign it. Those sections above, you can enter them if you want to, but they're typically for treatment plans for folks, and this is supposed to be super quick for you guys because we do realize you already have your own system. DMH and I will talk offline about potentially getting the workflow a lot shorter. And as Val went through today, this is training, so she's going through things, very meticulously to show you guys everything. But the workflow is pretty concise and short once you get in there and start entering stuff in.
Yeah. So I put in my note, and then I'm going to sign my note. And that goes into, now it's in that grayed out box. This is my note for the encounter. It's signed by Val Hewitt as on today at this time. And once I have that done, I have my encounter note sent in. I'm going to go ahead and click finish. And I'm good to go. So you can see here, as you add notes and as there are additional notes, you can use these searches. So you can search in a date range. Let's say I only want to see the notes from the last 2 weeks, or I only want to see the notes from this month. You can use the start date and end date to narrow down what you're looking at.
And just to make a comment there, so if you guys see over in the right hand column, the status is not released. So if you go back into that, Val, so when you guys click save throughout the system, it's going to save and keep you on that same screen. If you click finish, it's going to save and take you to the previous screen or whatever list screen that was. So in order, if this is a billable service and you receive funds for this, if you scroll up a little bit now, you guys will see that billable drop down there next to service. It says billable yes, no. That defaults to yes. So if it is a billable service, just leave it that way. If it's not, you can put it as no. It just depends on what your process is. And then as Val showed you, you want to enter your note, sign it, and then at the bottom, when you click release to billing, so the client group enrollment drop down, so you see that note at the top. So that's just, these are informational messages, as you guys, when we did the basics training back in March. But that's just giving you informational notes throughout the system. But it's going to give you that client group enrollment there. So that's the one where when we enter the client profile, we enrolled them into that group enrollment. So if we don't do that, then there would have been nothing here for us to choose from, and we would not have been able to release it to billing. So that's why it's very important under client profile when you're entering the client to make sure you also put them in a group. Okay? And then you would just click finish and you can move on. And then, depending on your process, you can just click finish there or cancel out of it now. Yeah, depending on your process, once you enter the encounters, you would then, when they, and this may be a DMH question, DMH, I don't know if you want to put some kind of policy around this, but you can enter the discharge, the GPRA discharge when you do the follow-up if services are complete, or you can do the GPRA discharge when you truly discharge them from the system. So it just really all depends on what your process is. I have a question. Do we note an encounter after each time we make contact with the client, i.e. after doing the GPRA, would we complete an encounter note? So the encounters would be the true services and treatment they've received, but what you can do, if you scroll down a little bit, Denise, or sorry, Val, if you see the notes area under encounter, so there is a miscellaneous notes there. So anytime you do have contact with the client, like if you contact them for a follow-up, if that's going to be the process, and DMH will define that, who should be contacting for the follow-up, you want to record that here. So that way, you can see, the state DMH can see that you try to get a hold of this person 20 times within that 3-month window, and you just could not get a hold of them. But you can enter a note here. You can also enter encounter notes right from this notes area as well. But you could use miscellaneous notes for things like that. The encounter should be used for true services rendered. And then you have the miscellaneous notes there for other different types of actual encounters or contact with the client. Does that answer your question? So make sure I answered that question.
Excellent. Yeah. Excellent question. Does anybody else have any other questions? So to discharge a client in WITS, you want to update the outcome measures and then update the program enrollment. So if we go through to update that information, the first thing I'm going to do is update the outcome measure. And from here, we have our initial one. So I'm going to click Add New. It will pull all of the information over from the last time it was recorded. So we'd want to go through and make any changes. So I'm going to change the date to today. Then I'm going to say, okay, the frequency is now no use in the past month. And all the rest of that information is the same. I'm going to go ahead and click the finish button here. And that'll bring us back. It'll say initial for the first one we did, and then update. And let's see what I forgot in my update because it's still in progress. Last date of last contact. There we go. So fill that out. Thanks for the heads up, Denise. Then I'll go ahead and click finish. There we go. Now that's completed. I will go to my program enrollment on the left-hand side and click the pencil to review my program enrollment. And from here, what I'll do is put in my end date and select now my termination reason is required. Let's say Jake completed the program, completed treatment with no substance use. Go Jake. And then we'll go ahead and click finish. And we are good to go. We're right up to the line now. Does anybody have any questions on anything that we've gone over? You guys have all been so awesome.
Denise, do you want us to show the GPRA discharge or actually discharging the client from the record? If you can pop back over there. So we're going to discharge the client from the record. So pop back into the system
Sure.
now, please. So once you guys have entered in your, you've gone through the process, you've entered the GPRA intake interview, 3 months later, you start trying to get a hold of the person for a follow-up I'm sorry, 5 months later. At 8 months, that window closes. Hopefully you got a hold of them. So you'll have the follow-up completed. And then at that point, you guys will enter a discharge, GPRA discharge. And after that's all completed and you've entered your encounters and everything's finished, then you would actually discharge the client here in the system so that their case is then closed. So you click on discharge. Now, for whatever reason, you were still in that program, as Val showed you, she did the disenrollment. If for whatever reason you get that and they're still enrolled in a program, that'll just pop you back up to that program area and you can then enter that termination reason. But if they've been ended from all programs, then when you click on this discharge, it'll just be like this. It's kind of like the admission screen. It has those few fields to enter, and that way this will close out the case.
Yeah. So client is discharged. You want to close this case also. So we have all of that on our client activity list. We are good to go.
So,
right. Nothing else I'm missing?
Denise, DMH, do you want them when they do the discharge, would you like them at that point to also close the case as Val just showed? If not, you'll just have clients with open case statuses. Yes, so at that point you guys would close the case because each client only needs to receive one GPRA. So yeah, any other questions? Denise, is there anything else you want us to touch on? We will work with DMH to make sure that we have the process understood and completed for doing the follow-ups. And then if we need to, depending on who's going to be in charge of the follow-ups, whether that's going to be a WITS admin or you guys as the providers yourselves, we will do another training closer to that time. We don't want to do it now because if you don't use it, you're going to lose it. But we would do it because you guys can start reaching out at a 5-month mark. So we would do it, into probably the beginning of end of first quarter of the new year. And then any other areas that we need to show you guys, we can set up as a separate training as well. I think this was a good amount that we showed you for the SOR specific process. Any questions? Anybody else have any other questions for Val or myself or Denise and DMH? Will we be adding GPRA full access role to staff users? Yeah, so DMH, you should add, in order for the providers to use a system, they would need the GPRA full access role. You can add that at your discretion whenever you want them to be able to start entering. As soon as they have that and they know which programs to use to enroll the clients in, and they can start using the system, you may want to just kind of send out a notice letting them know when to use the system. I don't know if you have an idea in your head when you would like them to start entering their SOR clients. But anything else? Anybody else have any questions? Any providers on the call have any questions or anything for Val, myself, or Denise and the DMH team?
All right. Well, the very last thing I'm going to ask you guys to do is we have a very quick survey. I think it's 4 questions, maybe. I put the link in the chat. If you guys could take a minute to fill that out, we would really appreciate it. And thank you so much for your time and attention today. Does anybody want to hear a bad dad joke to like play us out?
No, nobody wants to hear that.
Too bad, Kate. What is a giraffe's favorite fruit? A nectarine. Get it?
I think we're all very glad we heard that today.
So glad. Tell your local 4th grader.
Gigi, do not egg her on. Gigi's laughing at me, so you're welcome.
There's always one who appreciates it in a training. Excellent.
All right.
So thank you guys so much, and have a great and hopefully very busy and productive Monday after break.
And just as a closing, we, as we mentioned a few times on the call today, you guys can expect some communication from Denise and the DMH team to send out, where you can find the updated user guide as well as this recording. We'll also send out the survey link in that email. That way you guys just have it. And then, any other process questions or concerns that came up or that you have, will be included in that communication, and then just feel free to email that as well to the DMH team. I'll also make sure that we put the information in there so you guys know who to contact and how to contact your WITS administrator. All right, well, thank you all for attending. I know you guys are very busy, so we appreciate your time, and thank you, Val, for leading the training, and thank you, DMH and Denise Jones and team for putting this training together for the providers. Okay.
Thanks, guys. Have a great rest of your day.
Bye, guys.